Safe staffing is all about having enough nurses on duty to deliver care safely. It seems totally obvious that having enough nurses is going to make a difference to the quality of care. But actually, up until a few years ago, we have no limits on how many patients a nurse in hospital looks after. So whereas if you're a childminder, there's a legislation in place to make sure that you don't have more than a certain number of children per childminder. And the same in schools, you're only allowed class sizes of a certain size. In nursing and in healthcare, that doesn't exist. This obviously puts patients at risk because some places have much lower staffing levels than others, and that's what some of our research found, that there's huge variation in how many nurses are actually present. And what's been important then is that our research has helped to show why it matters, and that's actually changed the way people think about nursing and nurse staffing and has led to different policies and guidance being created. Without doing this research, we may still have been in a context where decisions about nurse staffing were left entirely up to hospitals to make. And when budgets are tight, nursing makes up a significant portion of total expenditure because nursing is so much needed as part of care, that becomes a place where hospitals have looked for savings. This is a critically important intervention. And with other critically important interventions, maybe a type of surgery or a particular drug, you would want to make sure you get it right. In the same way with other interventions, if it was a new drug that happened to be cheaper, we would not allow hospitals to just use that drug without seeing what the impact is going to be on patients carefully. And yet, when it comes to nurse staffing, we have allowed this intervention to be done in a way that doesn't necessarily protect patients. So we've allowed patients to be exposed to harmful low levels of staffing. And that's why it's been so important to make that harm and that risk much more apparent. At the moment, we have a national shortage of nurses in the UK. We've got something like in excess of 40,000 too few registered nurses. What do you need to be able to get more nurses? What you need is partly to be making sure you're providing conditions that allow nurses to give good care to patients. Conversely, if you provide nurses a situation in which they're not able to look after their patients properly, they're having to leave things undone, it wears away a person's feeling about their job. It drags someone down. We end up with burnt out nurses who feel very stressed by their work and who end up leaving. But to get more nurses actually requires us to have nurses in place, because too few nurses means it's not a good place to work. We've generated research data that shows how important it is, why it's important, that shows that when there's not enough nurses, care gets left undone. When care gets missed, patients end up dying. Patients that shouldn't have died. Patients that, due to their illness, were predicted not to die, have ended up dying unnecessarily. So it's really vitally important that we haven't just generated that evidence, but it gets used. It gets used to change practice and to change policy. Now we can see what the harm is. It puts the onus on policymakers, not just in the UK, but actually around the world, to use that evidence. Once you know that something is harmful potentially to patients, harmful to the people that are in your care, it becomes negligent not to use that evidence to make sure that you do the right thing.